Let me welcome my guests for this morning's discussion. And in the studio, Dr. Amapokua Fenny, who is Research Fellow, Institute of Statistical, Social and Economic Research, ISA. Thank you very much for making the time to join us.
Thank you.
Great. Also, Dr. Justice Yankson is General Secretary, the Ghana Medical Association, GMA, and he's a lawyer too. Good morning.
Good morning, Sam.
Right. Good for making the time. We have Dr. Gordon Abaka Nkrumah, Senior Lecturer, University of Ghana Business School, on Zoom. Doc, good morning, and thanks for joining us. All right, kindly unmute yourself.
Sorry. Yeah, good morning, and thank you very much.
Thank you so much for making the time. So, as we have announced, we are going to look at the various constitutions, the two of the NDC and the NPP, and what they have for Ghanaians by way of jobs. The NPP constitution, which was Manifesto, which was launched first, is entitled Leadership of Service, Protecting Our Progress, Transforming Ghana for All. Leadership of Service, Protecting Our Progress, Transforming Ghana for All. Then they have the subtitles, For More, To Do More for You. The battle is still the Lord's. Then the NDC has jobs, prosperity, and more. I suppose you haven't paid attention to that. You have always been listening to the People's Manifesto. The NDC's manifesto is jobs, prosperity, and more. The People's Manifesto. Somehow, everybody has more somewhere in their manifesto. So this morning, we are interrogating the promises or the policies proposed by these two parties for the health sector, for the health of the country, and for the health of the country by way of job creation. So, let's get straight away and begin to ask our guests what they have been reading and what they think. But before that, we have some of the people associated with these manifestos speaking on various parts of it. But the portions that we have specifically deal with the area of jobs. So we will just listen to Vice President Dr. Mahmoud Bawumia on the health sector. Dr. Mahmoud Bawumia had something to say on the health sector. So we'll listen to him and then return to the studio to do the discussion. When we get to the next issue about jobs, we have President Mahama, we have Mahmoud Bawumia, and others also speaking about the questioning of jobs.
Agenda 111, which used to be Agenda 88, we're going to build district hospitals wherever they are none, 102 in all, 2 additional psychiatric hospitals, and 7 regional hospitals. 6 in each of the new regions. We are building the regional hospitals in the 6 new regions, and 1 in Western region, in addition to the rehabilitation of Efiankwanta Hospital. So that is a major infrastructure area that we are going, and it's the biggest healthcare infrastructure that we are going to be putting in place for many, many years. We will focus, ladies and gentlemen, on health promotion and prevention as part of primary health care through the National Health Insurance Scheme to achieve universal health care. It is important for us to note that 95% of the disease burden is already covered under NHIS primary, secondary, or tertiary diseases. It's already covered. And children, the elderly, and vulnerable groups, don't have to pay the NHIS premiums anyway. Our focus is going to be on the promotion and prevention of, primary health and promotion and prevention as part of primary health care. We are also going to work with the Ghana Medical and Dental Council to streamline the admission processes for foreign-trained doctors. The discussions with a lot of foreign-trained doctors speaks to a lot of frustration that they have in joining the normal medical corps, especially some of our brothers and sisters who have trained in Cuba when they come in. We're going to discuss with the Ghana Medical Council to streamline those processes to enhance access. We will also help by expanding access to medical schools in Ghana by building additional facilities and augment its human resource base.
So that's Dr. Bawumia on some highlights of the NPP's manifesto of 22 promises in the health sector. 22 promises in the health sector. The NDC, and forgive us, we have a technical problem, but we should have been playing you some from the NDC as well. Now, the NDC in the health sector, they have 67 promises in the health sector, as against the NPP's 22 promises. So our guests will help us deal with the question of who has a superior policy orientation as regards the health sector. Let's begin with Dr. Yankson. You have looked at the NDC and the NPP manifestos in the area of health. How does it strike you what they are seeking to do? And they speak about health from page 60 onwards for the NDC. How does it strike you what they are seeking to do, and how feasible are these things that they suggest to do?
Okay, Samson, let me start this way, that if you go through the two manifestos, it is clear that there are some areas that the two parties generally seem to agree on. So issues like health infrastructure generally, they seem to agree on.
Right.
In terms of the details, there are a bit of variations. Issues around the use of technology to aid healthcare delivery, so e-health, telemedicine, issues of that nature. Those about human resource, trying to recruit professionals. Issues around preventive healthcare. They are trying to, they seem to have virtually the same ideas. One striking thing is that everybody has a take on the use of sanitary pads for school girls. And whilst NDC is talking about sanitary pads going to be free for all school kids, NPP is talking about waiving taxes on, these essential items for the young ladies or girls who are menstruating. So you can see that, at least on the surface, as a country, there are a few areas that the two major political parties agree that the health sector actually needs to be resourced as far as those bits are concerned. And I think that is good for all of us. What it means is that either way, whichever party comes to power, some of these things are going to be done. Then we have some areas that seem to be very unique to the two parties. Let me pick one of each to start off with. We'll go into the others, because I think that these are the major ones. If you look at the MPP manifesto, they are talking about this huge, unprecedented, infrastructure that is going to happen. It's about 101 facilities.
Yes, 111.
Yes, from district hospitals to infectious.
Does it sound to you that that was actually properly planned, or the president was just speaking and they began to think about it, how to do it? Because he didn't start with 111. It was during the COVID-19 messages that he was giving. Then he came up with a plan that, okay, the places that don't have, the regions, they will have one each. And then later he came and then made an addition. What do you think? Does it sound like they didn't actually set out to plan for this?
Well, I don't speak for them, but I suspect they may have thought through. The reason is that at the point where the president made the initial announcement, he made it clear that COVID had exposed the weaknesses we had in the health system.
That's right.
And that these were some of the measures that he was going to take to at least fix those lapses within the healthcare system. So at least up until that time, I'm sure they had gone through a lot of activity, and clearly they had identified that, look, this is a Waterloo area as far as we are concerned as a country. So probably they thought through it. Then subsequently, post his initial announcement, you realize that the number had moved up to the 111. Initially it was 88 plus another 6.
That's right.
94.
That's right.
So clearly, post the announcement, I'm sure they've done some further work. So I think that they may have thought through. That is the way I see it.
In fact, the promise was that was going to be done within a year.
Yes, in fact, that was the initial.
And people raised doubts about it.
And those are some of the things that we are going to interrogate now, because now that it's been elevated to 111, and clearly from what I'm seeing, this is going to be for the next 4 years, post the elections. Right. Because there's the manifesto for the next 4 years. So the question is, are we going to see any activity based on the president's initial, announcements, or everything has now been shifted to the next term, assuming they are in power? But if you look at that policy, for me, truth is this: it is good to have that dream that every single district in this country should have a health facility that we can describe as a district hospital. Okay. Because it forms the basis of our healthcare delivery system. That is where the primary level actually terminates. So from the chief, sub-districts, what have you, the peak of it for the primary healthcare is at a district level. So I think that it is a good idea. However, okay, let me also add that the others, i.e. the regional hospitals, they are also essential, because the policy is that every region ought to have a regional hospital. Now, these regional hospitals serve as the secondary level in terms of the scheme of things. Sometimes, out of constraint, they are forced to do some tertiary care activity, just like the district sometimes also do some secondary level activity. But at least, for me, that is also a good idea. Issues around infectious diseases, clearly, when COVID came in, we were all exposed badly. So the need for infectious disease centers and Ghana CDC, all these things are very important. So at least per the arrangement on paper, we think that these are very good ideas. Now the critical thing is, if you look at the level of the infrastructure that they want to put up, in terms of the numbers, you ask yourself, as a people, over the last, let's say, 20 years, have we ever done anything like that? And even where you look at individual, government in terms of their reign, the 4-year terms, have we ever done anything that massive? Well, the answer is no. And anytime we've tried to do something, which you can even say maybe about 20-25% of it for the 4-year term, you realize that by the time the party or the government is out of place, out of office, clearly most of it will not have been done. Either some will be in various, developmental stages, and the next phase is that we all hear government has abandoned the project and what have you. So this good, brilliant idea, in terms of implementation, we think that there are very, very, very serious issues that we need to be looking at. Issues of finance. But of course, if you are smart within this COVID era, you may have a lot of grants.
You have identified and highlighted portions in the NPP's manifesto.
Yes.
Can we do a similar thing for the NDC?
That's what I'm going to do.
And the NPP dedicates only 2 pages. I think 2 pages from 62, 63, and that's it. And they have 22 promises in there. The NDC from 60 to page 67. So they have quite a lot of, promises to make in the health sector. So let's look at the NDC too.
So let me just conclude on this.
What catches your eye?
This bit
right.
that I took.
Right.
That for the MPP, what catches their eye is this infrastructure bit. And we think that as a people, we need to hold them to strict accountability, assuming they win the elections. And they need to deliver within a certain framework. The president had already promised 1 year. Even though they never added any timelines, I think that for the district hospitals, it shouldn't go beyond 2 years.
Okay.
Because you gave a promise of 1 year, 6 months COVID-related.
Why? They have given you 1 year and you are still making allowance for them that they should do at least 2 years.
No, what I'm saying, I said it should not go beyond 2 years. The reason is that the first promise, 6 months of it is almost going to elapse.
So we still hold the president to that.
I don't have a problem.
He has an oath to be faithful to the
then
citizens.
There are two issues here. The president's first pronouncement, which was within this COVID era.
Right.
We can decide to still hold him to it. That is fair. But for this manifesto, clearly it is for 2021 beyond. So that's why I'm saying that if you look at this manifesto.
But his COVID promise is the pillar, as far as health infrastructure is concerned.
Yes.
Is the major pillar of the manifesto.
I agree.
Right.
Yes. Now to the NDC, the most important thing that I have picked in there, that is not to say the others are not important, or the very catchy one, is what they have described as the free primary health care. And I think that policy is one that we need to also really look at how they are going to implement it, because it raises a lot of issues. Yes, the policy itself is good because we want everybody to get access to primary health care. So on that basis, it is okay. But when we go into the free, then the issues begin to come up. The first thing is that if the district level services, so from the district hospital down to the CHIP compound, the services that they provide are going to be free. The first issue that comes up is that what becomes of our national health insurance? Because with this promise, if they are implementing, then at least from the district level downwards, anybody who decides to access primary health care in those facilities, it has to be free. You do not need to have a health insurance card. So they will need to clarify that area for us. Is it that the health insurance cards are now going to be limited to secondary and tertiary care only? Or there's going to be that we still will have to pay for those health insurance to still cover the primary health care? If that is the case, then that cannot be free, because I would have financed my health care through the insurance premium that I have paid. So clearly, the NDC will need to let all of us understand how this is going to be done. The other bit is that primary health care constitutes the bulk of what we do. Now, if you look at the way our health facilities are distributed, most of the times, the primary health care activities, but for a few, but for some facilities within the cities, the chunk of the country, it is this district hospitals, CHIP compounds, sub-district facilities, health centers, what have you, that actually take care of the health needs of the people. And all of these facilities, by and large, those in the public domain, actually depend on the health insurance as their main source of funding. So once it is going to be free, then what it means is that that source of funding is also going to be taken away. They are not going to be in a position to generate internally, to get what we call internally generated funds. They will not be in a position to get them, except what will be given by government. Now, then comes the issue. How regular are we going to get this funding to the health facilities? Else we run the risk of crashing them. We know the history of healthcare practice in this country. We've gone through free healthcare in the past. When we were kids, most hospitals virtually were free. Then it collapsed, we came to cash and carry. Cash and carry became a burden at some point. We introduced health insurance. So clearly, we have moved from free to cash and carry to health insurance. And now, there's even talk of, in quote, co-payment. So if you are now going to go back to free, are we quite sure that we are not going to retrogress? Because we all know how difficult sometimes it is for government to raise revenues to provide for the social goods that we all ask for. You also ask yourself, as a country, within the Fourth Republican constitutional era, we have never been able to attain what ECOWAS has agreed on as a benchmark, that 15% of our GDP should be used for healthcare. I think the best we've done is about 9 or so. But a lot of times we hover between 5, 6 to about 7, 8. The issue here is most times a chunk of this percentage, which is woefully below the 15%, is actually for compensation. So what is left for real care at the health facility level sometimes don't even happen at all.
Okay.
So they still depend on their internally generated. They will need to.
You can pause there. I'll return to ask you very specifics in both manifestos. And as you know, we have a lot more in the NDC's manifesto. So we have a lot of issues to raise in there. Right. Yes, so let's hear you too. What do you say are the things that, catch your attention when you, from where you sit at ISE, you look at the two manifestos in the area of health?
Thank you very much. Looking at both manifestos, NDCs and NPP, you realize that they are very heavy on digitization, especially for the NDC. It has a very long list of investments into the e-health, telemedicine. These are very big programs. And I know that, for example, COVID has exposed a lot of these issues because of what we've had to...
Both parties make that admission in their manifestos.
Exactly. But the key thing is, how are we going to finance these programs? When it comes to financing, you don't see very clear messages from both manifestos. I mean, how is the government going to raise revenues, to spend on these big programs? If you look at financing, for example, the NPP has talked about rescuing, restructuring, and increasing budgetary allocations to the NHIS. I mean, this has been a big issue for us for a while. The NHIS having arrears beyond 12 months, and now it's 3 months, and it's more, it's better than before, but it's still a key barrier to access for a lot of facilities. And so we look at all these big promises and we are wondering, how are these going to be financed? I'm not sure both manifestos have very clear items about health financing. NDC is saying that it will, increase domestic financing for health. But then when you look at the specific objectives, you look at IGF being removed, the cap on IGF being removed, but it doesn't talk about how IGF will be generated, And then it talks about NHIF, being given 30 days from the Ministry of Finance directly within 30 days. But then how is the money going to be released from the Ministry of Finance? How is that going to be raised? So I think there's no clear direction when it comes to raising of government revenues for the health sector. And that is very worrying. You have a long list of items here. You have the huge infrastructural investments that are going to be made by both parties, but there's no clear direction as to how these revenues will be raised. The NPP's manifesto talks about private sector engagement. And for a long time, we have talked about how to engage the private sector to help raise revenues for health, widen the scope. We've seen that in COVID, during the COVID pandemic, how the private sector has come up, strongly to support the health sector. Funds have been raised through private sector and businesses, and this has been very helpful. Can we continue? We don't see those clear items within each of these manifestos. So beyond service delivery, how do we engage the private sector in domestic resource mobilization? So those are very huge areas I think we should consider. You can have a long list, but if you don't have the money to finance it, then really...
So let's interrogate the lists of goodies, the list of policies or policy orientations or promises. That's what we should be interrogating. Yes, the question of financing, everybody has raised that issue about whether or not this is feasible. But beyond that, can we look at the items as the two parties have provided them what they intend to do in the area of health and see whether they are good for the people and so on and so forth. Because if we have to remain at looking at whether it can be, there will be money for it, then we may simply, not have any discussion. Right. Yes. So yes. So Doc.
Okay. So when you look at the specifics within each of the, again, like you said, the NDC has a very long list. The NPP's manifesto has 2 pages, but then there are 2 pages of things that they are already doing and things that they will continue to do.
Things they have done. Yes, they are doing and intend to do.
Exactly. So I think, to be fair, it makes some sense to have a smaller list than those who are trying to come in.
So under health, the NPP says at paragraph 131 going, it says restore nurses trainees nurse trainees training allowances restored, facilitate the early placement of trained nurses, public health personnel and teachers denied employment by the NDC. All nurses denied engagement by the NDC have been placed. Then provide free specialist postgraduate training. Free specialist postgraduate medical training commenced in the 2018-2019 academic year. Then strengthen the National Ambulance Service. They say over 300 ambulances supplied to the National Ambulance Authority, 1 in every constituency under the One Constituency, One Ambulance initiative. The authority has also been provided with a state-of-the-art digitized command center to field emergency calls and to dispatch ambulances. So all we have read so far is not what they intend to do, but things that they say have been done.
Exactly.
They say establish centers for cancers and cover the cost under NHIS. This must be important, right? Establish centers for cancers and cover the cost under NHIS. So cancer treatment is not covered under NHIS. They want to do so. Then this is they give you what they make a statement and they provide a sort of an answer. They say breast cancer is already covered by the scheme. Herceptin, the expensive cancer drug, has now also been added and is paid for by the NHIS. So still, we haven't seen something they say they intend to do. They are telling us what they wanted to do that they have done.
But this one, they haven't been able to do all.
But is it
about establishing centers? They
don't say anything apart from that. They have given you the answer to say they are finished doing it.
No, it cannot be, because see, you read what the intention was.
Establish centers for cancers and cover the cost under NHIS. Okay,
so where are the centers?
Okay. All they tell us is that breast cancer is already covered.
So you can say that is cost.
The most expensive medicine for cancer drug has also now been added and is paid for by the NHIS.
So that is the cost. So the centers component.
So is this clear enough? When it says establish centers, is it too general for your liking?
Well, as far as I'm concerned, cancer care is somewhat specialized, not as somewhat, it is a specialized area. So for example, you go to Kolebu, you have the oncology radiotherapy units. Konfanoche has one. But you can't have these, you don't have these centers dotted around the country.
So we have centers.
Yes.
We have cancer centers.
Yes, these are specialized centers. We have some that are focused on, let's say, pediatric cancer. So Kolebu, for
So this is not good enough. This statement is not good enough.
It is not that it's not good enough. It is the intention, but they have not been able to discharge all. That is what it means.
They say establish centers.
Yes.
Okay, so within the last 4 years, has the NPP established any cancer center?
That is what I'm saying, that the centers we have
already exist.
No, there are some that exist.
Yes. Have they established any within the period?
If you say any, you mean new ones.
Yes.
And I'm saying that new ones haven't happened.
Great. So they should be telling us that they will establish the new ones.
But even in their answer,
Okay.
did they provide for same? No.
They don't say that.
Yes.
So they leave it out.
Yeah, so we will interrogate it based on what they have stated themselves.
Okay. Does this sound to you that it's cast in a way to be able to have an excuse if they don't do it?
No.
Let me ask Abena. Yeah.
No, so I don't think it's an excuse, but I think it's a continuation of something they have decided they will do. So I'm seeing this as a continuation, not
so
as
in
an excuse.
in the portions where they tell you what they have done.
Yes.
Should they not be telling us
What they have
done about establishing the centers?
Ideally,
rather than telling us that breast
should
cancer
have happened.
When did breast cancer become covered under NHIS?
I can't really remember the exact.
It would be under this government.
No, I think it may predate.
Okay.
May predate. But Samson, let's look at it.
All right. So wait. Let me go to our other guest so that we don't forget that Dr. Gordon Abaka Nkrumah is on there with us. Let's have your preliminary views on the two manifestos as regards the health sectors. I will return after I hear all of you, your preliminary views, to point out specific portions and have you make your comments. That's if you don't take care of them in your submissions. Yes. Dr. Abaka, yeah.
Thank you very much, and good morning to your listeners, Samson. So basically, I think that what I want to do in the initial analysis is to basically look at the structure of the health manifestos of the two parties, and then we can look at the content and see whether and judge the content on relevance, how feasible they are, the fiscal integrity of the contents there, and what the impacts is likely to be. So in terms of the structure, I've actually decided to look at the health manifestos of the two parties from 2012 up to the 2020 manifestos. And I would say that from 2012 up to 2020, probably the best that I've found is the MPP manifesto for 2016, which seems to be very aspirational and tends to tackle the fundamental systemic challenges within the health sector. So what I would have loved to see within their 2020 manifesto would have been to actually tell us what their aspirations were for the 2016 manifesto, what they've done so far, and with a list of items that they have accomplished, what part of the aspirations have they achieved, and what is left, and the list that they've put there, okay, what is it going to do to complete the 2016 agenda? So that is what I would have wanted to see. But you see some sort of a scanty portion which does not give the sort of enthusiasm that the reader would want to have. Then you come to the NDC, that is really loaded, has a lot of things in it, but basically I see a lot of them as operational and not strategic, and so not so exciting, but there are a few of them that are exciting. So in terms of the structure, that is what I would say. In terms of the content, I would want to analyze it in the context of what everybody would seek to do in terms of changing a health system. And within a health system, there are fundamental building blocks. And these are leadership and governance, human resources for health, health financing, access to essential medicines and technology, health information, health financing, and I will add one which is not subscribed by WHO though, as community participation. Now, if you look at the two manifestos, all of them essentially address the fundamental 6 building blocks of a health system, albeit that their focus tends to be on service delivery, and all the two are so massive on infrastructure, all the two are massive on human resources for health, and all the two also talk about some amount of digitization and access to essential medicines. Now, in terms of the relevance, if you pitch it against national relevance, currently our national push is towards universal health coverage. And it seems to me that the preamble of the two manifestos are all towards the achievement of universal coverage. So at the national level, I can say that the manifestos are relevant. In terms of our international commitment as a country, the manifesto speaks to 8 out of the 12 SDG targets. That is SDG 3, which is around health. So in terms of relevance, I would say that yes, they are relevant, okay, at the broad level in terms of our national aspirations and in terms of our aspirations within the international community. Then you want to talk about the feasibility. So the feasibility, I'll pick 2 major ones. That is capacity and then political feasibility. So in terms of capacity, there are some of the items that I can see can be very challenging. So for instance, all of them talk about really building all these hospitals, district, regional, police hospitals scattered all over the place. My question is, who is going to run these hospitals? We have the General Secretary for the Medical and Dental Council there, and he will tell you that we don't have the people who will go and run all these hospitals within the next 4 years. And we don't even have a systematic strategy in terms of how we are going to train people. Now they talk about really scaling up centers that will deal with NCDs all over the place. My question is, who is going to run these centers? I'll give you something, a typical example. In Ghana, every male above the age of 40 is a potential urological candidate. But in Ghana, we don't have more than 15 urologists in this country. So when you have all these entities dotted over the place, who will run them? So I have issues in terms of the capacity to deliver some of this. What about the politics of it? So for instance, I'll give you a typical example, and that will come from the NDC manifesto. NDC talks about they making sure that they implement the NHIS law so that all the money goes straight into the NHIS fund. This has not been possible since 2003 when the fund was established. And the reason is because the Minister of Finance, in terms of the structure of our budget, lacks a lot of discretion. So sometimes they use some of these funds to make sure that they are able to manage things. If you look at the 2020 budget, look, interest financing alone is somewhere around 25%, and salaries is about 31%, and grants to government departments is about 20-something%, which is a total of about 70%. So as soon as the budget lands, about 70% of the money is actually earmarked. So for you to say you are going to earmark NHIS by ensuring that the law is implemented to the letter, I doubt if that can be done, because both NDC and MPP have been in power. They have not been able to do that. And so I'm wondering what is going to make them do that.
Okay,
now,
so the manifesto is a social contract, is that not so?
Exactly.
And we, the electorate, are supposed to hold them to account to fulfill the manifesto promises, not so?
Yes.
So if there is something that is so worrying to you as you state, and it's not been done over the period, and we have a party promising to do what you say is the best that ought to be done, is that not worth, applauding and then waiting to hold them to account?
Yes, thank you very much, Samson. The point is that it is one thing to say I will do this, and it is another thing to find out whether there are constraints, because those constraints are structural. So if you tell me you do it, then I want to see what is your plan for dealing with those structural rigidities.
Okay. And in this particular matter, your concern is that it's a question of too much discretion on the part of the finance minister in diverting or deciding to take portions of the fund to do other things. Is this not easy to do?
That's not what I said. I said that the structure of the budget takes so much discretion away from the Minister of Finance. Okay. I'll give you a typical example. The budget comes, okay, and already interest payments, salaries are taking, and certain commitments are taking just about 70%. So when there is any emergency, the hands of the minister is tied. So if there is any fund there for national security purposes, the minister will have no option than to reallocate resources. It's just because of the structural rigidities of our budget. And unless, of course, we can see something which shows that we will not borrow, but that does not seem to be the case.
So let's interrogate that a little further. Did the NDC ever cap the NHIS? That fund, the fund we are talking about, did the NDC ever cap it?
No.
Correct. So are they not more believable in delivering what they have just promised?
So let me come back again. This is what I'm saying, that yes, it is a good thing if we say we will enforce the law, but I would rather applaud them if they said they were going to enact a new law such that the money in the NHIS, okay, will be treated like what we do to the petroleum fund, where the money goes in there and the Minister of Finance can only touch it if they go to Parliament.
Okay, so your problem therefore is that
the Minister of Finance had to go to Parliament to be able to touch that money.
So your problem
will be comfortable.
Your major problem
goes to the consolidated fund in this manner.
Your major problem therefore, your major, Dr. Abekan, your major problem therefore is that the policy lacks detail in implementation, and that's what you want to see.
Exactly.
Go to the next point you were moving to.
Okay, so in terms of the feasibility, so for instance, there's another promise to increase maternity leave and then even extend it to extend. Now, this has been an issue on the discussion board for a very long time. The reason why it hasn't been done is because once you extend maternity leave, there is cost implications. The state will have to agree that they are going to bear the extra cost. In UK, maternity leave is 9 months. The base is 4 months, where Ghana, the base is 3 months. That 4 months is absorbed by the employer, but the excess, which is 5 months, is absorbed by the state. So the question is, where is the money to absorb that? Because the employers are not going to absorb that. So I have issues when it comes to the political feasibility of some of the items. Then
you mean financial or political feasibility?
So here it's a stakeholder issue, okay? And I think that one, the employer, government might not be able to, because it's a political economy issue. Will the government be able to sort of engage with the stakeholders in the labor market to agree that they are going to take up that? Now, if that does not happen, chances are that that will become some sort of a door to block people, and majority of them will be women. So I see it as some sort of a political economy issue. So it's both politics and then finance.
What is the issue about the financial feasibility of the maternity extension of the maternity leave, which the NDC captures as part of its health program? Now, I ask that because, for example, shouldn't it be a question of a party's or a particular government's decision as to priority? They said they intend to amend the law to provide 4 months maternity leave in addition to the existing legal maternity provisions and grant 7 days paternity leave. You say extending the maternity leave by 1 more month will be too costly, and it comes to questions of productivity, as I heard you, we have implemented free SHS and we intend to expand it. Some have promised, expand it to include private sector. Is it not a question of priority?
You are perfectly right. And I've been one of those who have argued that maternity leave should be extended, because if we're saying that exclusive breastfeeding should be 6 months, then it doesn't make sense to have maternity leave for 3 months.
So it's not a question of inability.
So I applaud that. But the question I'm asking right now, because you see, when we talk about programs, it is not a wish list. It is something that must be doable. And so I am asking right now that where is the money going to come from? And I'll be coming to the fiscal integrity of these promises, which we'll get into. So it's not just about you promising. It is about something that you promise that I believe that it is what? It is possible. Okay. And I am telling you that for that promise, government will have to come up with the money for that extra 1 month and for the paternity leave to be able to show that because if I look at the engagement, it does not seem to me that employers will be willing to pay that, especially within the time in which we are. Something, remember, we were projected to grow at 6.8% at the beginning of the year. Now we are going to do less than 1%. We will be hovering around 0.9%. So at this point, if there is extra cost being brought to bear on employers, then government will have to bear that. And I want to ask, where is that money going to come from? Now let's come to the fiscal integrity of the promises they make. And here I'm going to pick on what I call the infrastructure spree. NPP talks about the Agenda 111, which Dr. Yankson was talking about. That is a good thing. I mean, in all, I don't think so. I tend to disagree with him. I do not think that that is the way to go, because over the last 10 years, we've had massive investments in infrastructure. Some of them that have been completed, that we've not been able to deploy them. Some of them that are not yet completed, that we can complete. So I do not think that the most efficient way of allocating our resources is to have 111. And that is the same to NDC. NDC also talks about massive investment in infrastructure. Yes, COVID has taught us that we lack certain things. But I mean, COVID is not a medical issue. COVID is a community issue. So I don't think that the best way to respond to COVID is to spew out infrastructure all over the place.
All right.
Because if we have a good community strategy, we would be able to deal with infectious disease outbreaks.
All right.
So I don't think that is what to do.
So all of them are talking about these infrastructure, and now the NDC is even talking about electoral area chip compounds and among others. Now, let's get back to setting specific issues and get them clarified as far as your positions are concerned. You raise issue with the free primary health care. Now, they say that the free primary health care, these are the deliverables that they expect: health, education, and promotion, proper nutrition, adequate supply of safe drinking water and sanitation, maternal and child health, including family planning, immunization against major infectious diseases, prevention and control of locally endemic diseases, including sanitation and good drinking water, appropriate treatment of common diseases and injuries, and provision of essential drugs. In fact, they suggest that the direct and indirect benefits are endless. Now, from what their view is that under the free primary health care policy, they will engage and empower the pharmacies, the drugstores, the chemical shops in the cities, towns, and villages with the right gadgets to diagnose common health conditions, and they will refer urgent or medical cases to the appropriate health facilities. they suggest to us that the active members of the NHIS is not up to even half of the Ghanaian population. The premium realized from NHIS is below 10% of its inflows. So out-of-pocket payments of all healthcare expenditure is 40%. Free primary healthcare is supposed to support all other forms of health financing. Is that sufficient explanation for you as regards this policy?
I think there are a lot of conflicting issues here. To start off with, chemists, drugstores, and the like are not points for diagnosis. They are licensed to supply medications based on diagnoses that have formerly been done in their health facilities. Two, there
common health conditions.
Hold on.
No, sorry.
Yes.
Common health conditions.
Yes.
In the pharmacy,
please.
Don't I get, when I go there, what is
please
this?
Please let me conclude.
Explain this to me. Now I can go to the pharmacy and can check whether I have malaria or not. What is that? Is that diagnosis?
Let me.
I'm seeking understanding. Is that a diagnosis?
Is malaria the only health condition that we have in this country?
No, they say common health conditions.
And is malaria the only common one?
I'm just seeking education.
Yeah, that is what I'm saying. That
you say health, the pharmacists don't do diagnosis. That was a categorical statement.
Samson, kindly listen to what I said properly. What I said is this: that one, these facilities, the drugstores, the pharmacists, the pharmacy shops, the chemists, they are not designed for diagnosis. Look, there's a big difference between a pharmacy shop, a chemist, and a drugstore. In a pharmacy shop proper, you have a pharmacist trained to handle, issues about medicine, drugs, I mean. Within that training, they have the capacity to help advise on basic ailments. Let's get the differences well. At the drugstore level, you have somebody, with all due respect, very low levels of education.
Do I hear you making a differentiation now from a pharmacy and a drugstore?
Yes, we need to get the
people. So you are making a differentiation?
Yes, we need to get the people of
What
Ghana
it means then is that you are amending your earlier categorical, emphatic statement.
No.
That pharmacies don't do diagnosis.
No, I never mentioned pharmacy.
That's what you said.
Please, you can go back and play that. I said these pharmacy shops, drugstores, chemists. I mentioned 3 of them, that they are not primarily designed as places for diagnosis.
To be frank, you are now qualifying the statement.
No. That is exactly what I said.
You proceed. You go ahead. Go
ahead.
Mm.
So what I'm saying is that if you are talking about primary care, and beyond this manifesto, we've also listened to the active players in there, and they are talking about district level care. And I'm saying that when you even read exactly what you read, there are issues of care in there, there are issues of diagnosis, there are issues of medical supplies, pharmaceutical supplies, and what have you, all bunched in there. They talk about the fact that NHIA is just about 10%, there's out of pocket of 40%. All these things are going to be scrapped because it's a well-founded, free primary health care at that district level.
They say they are going to engage and empower these facilities with the right gadgets to diagnose common health conditions.
You
say that's not feasible?
No, yes. You see, let me take the time to explain things for you properly. Diagnosis is not about gadgets only. You may be lucky to have a rapid diagnostic tool for, say, malaria. But that will not diagnose complicated malaria.
They say common.
No, hold on.
They say complicated.
Please. Malaria is a common disease. But within malaria, there are complexities. You can have cerebral malaria. You will still test positive. But that sort of condition is not meant to be handled at a drugstore. So that's what I'm saying, that we need to understand the details of the operational level activities properly.
Okay.
We are talking about financing. Within the financing structure, all they are trying to say is that they are going to do away with that, and the state will fund it. That is fair. If the state has the resources to fund it, I don't have a problem.
I put the question to you because you seem to give vent to the claim that What's the difference with this and NHIS?
No, that is not what I'm saying.
You understand that there are clear differences?
Listen.
And that the NHIS takes care of only 40%?
No. Samson, you are not getting what is happening here. Let's start from what we have now. What we have is that care at these facilities will have to be paid for by somebody.
Right.
One financing model now is the health insurance.
That's right.
So you go in, you have your health insurance, you get your care once it is within the scope.
Okay.
That is one. But you would have paid for the premium.
That's right.
The second is you don't have a card. So you pay out of pocket because you don't have a card.
That's right.
So this is the main financing model, or the two financing models that are happening at that level.
Right.
What the NDC is saying is that it is going to be well funded and free. So what it means is that technically you are going to scrap these two activities. I walk in to any of the centers that are part of the primary healthcare delivery system, and I'm going to get care for free.
Okay, so they are saying that your NHIS takes care of not even up to half of your population.
Yes.
Which means about half of your population is left without the NHIS care. And they say out-of-pocket payments constitute about 40%.
Yes.
So the intention of the primary health care is to support these forms of financing.
No, it is not supporting. It is going to scrap it.
Okay.
Once it is free, what it means is that whether I have an NHIS card or not, I can go in and access for free.
Okay.
So that out-of-pocket expenditure has now been taken over by the state.
All right.
My paying of premiums to NHIS has also been taken over by the state as far as primary health is concerned.
All right.
And within primary health, like they mentioned, issues of immunization and what have you, what it means is that the state is going to sponsor all. Mind you, as we speak, we depend on donor support.
Yeah.
So your problem here again is about the financing.
Yes.
The financing is the question.
That is the question. Then the next thing is that if you eliminate NHIS at that level, how are you going to implement NHIS at the secondary level?
Yeah.
The other bit is that per what they have told us, at the district level, care is going to be free.
Yeah.
But in practice, there are a lot of activities at the district level now, the district hospital, that technically speaking are for secondary care facilities. But because of the paucity of
let's hear
these institutions, they are done there. So the question one will have to ask is this. Those conditions that are also treated at the district level, how free are they going to be? Or we are going to put a line.
Do you have a brief comment on the maternity leave?
Yes.
And also some opportunity for guys to also enjoy some paternity leave?
To be honest with you, I fully endorse that bit of the NDC manifesto. Reason is that I have started in your studios at multimedia in the past to argue for such a thing. We have made formal calls to the state to amend the Labour Act to ensure that maternity leave is 4 months. At least.
All right.
So that for me is fair.
Okay.
Between your good self and myself, in the past, when we sat in the same labor law class, we've had a number of debates on
That's
this.
right.
Both of us are happy.
Yeah.
The paternity, I think, is also good for us.
Right.
The men these days are very much involved.
Yeah.
In the care of,
so like Dr. Yankson is mentioning,
the only bit I want to
when
say,
we sat in our labor law class, not only were the women unhappy because it was a bit unfair, but in the majority, the men seem to support the women that they deserve that. So this is sort of a direct answer to a need by the society. What's your view on that as well? And because it's going to be a national law, it's not only going to apply to the state jobs, government jobs,
private sector.
Even private sector, you have to comply. There are some who suggest that women are going to lose their jobs as a result of that. Without any, perhaps legal help in understanding that that may not be possible, what do you think?
Okay. So again, you're very right about the, financial feasibility of this particular law. We have to cost it. How many people are employed by the private sector? And the private sector is about profits. In fact, every sector should be about profit. But more so for the private sector to survive, they need to have valuable businesses that are bringing in profits. Now you tell them to allow their workforce to stay at home an extra 1 month, an extra 2 months, it has cost implications, you know. So the fear is eventually women of a certain age category will be left out of the workforce.
How?
They will not employ you if you are a woman and you are very likely to have a baby within the time that you are seeking employment, you know, and we can see it happening invariably.
Okay.
You know,
so we should do more than simply.
We should,
you
exactly,
want the 4 months.
I would want even 6 months.
Oh, come on.
You know, because.
Okay, so you want the 4 months, but there may be problems in private sector employment.
Exactly.
Now, in that regard, you want us to have more than just the maternity leave.
Exactly.
So that there's some sort of state compulsion again to ensure a balance in the employment factor.
It looks very good on paper.
Okay.
You know, but
so how about the primary healthcare matter too? Free primary healthcare.
So I have been one for free primary healthcare because I've always believed that we should not restrict care at that level because of failure to pay premiums. And mind you, if you look at the whole system, premiums are very marginal. You know, if you look at the structure of the NHIF funding mechanism, for example, premiums do not play a very big role. You know, so to bar access because of premium, then that becomes problematic. You know, we are talking about universal health coverage, and then the premium stands in the way of people getting access. So if at the district level, we can find a mechanism for government to support access to care at that level, then people can just go in to these facilities and get their care. But again, I understand where you come from, Dr. Yankson, when you talk about the secondary care. How do we differentiate the two? You know, do we have separate NHIS cards for secondary care when some district level facilities also provide, you know, secondary care and primary level care? So there's a lot to talk about when it comes to this area. It's laudable that the NDC puts this in its manifesto.
So the
but
NPP
again,
says,
it has operational issues that have to be looked at.
They are going to rescue, restructure, and increase budgetary allocation to the National Health Insurance Scheme. Now, this is what they say. In the column where they say what we have done so far. What we have done so far. Rescue, restructure, and increase budgetary allocation to the National Health Insurance Scheme. What we have done so far. NHIS has undergone restructuring, including digital mobile membership renewal. Okay, this is obviously very fantastic. Many people are excited about that. You have too many unnecessary queues, and people go stand at the places for days without being attended to just to renew. So this is very good. And real-time data authentication. Members increased from 10.6 million to 12.2 million. NHIS arrears have been reduced from 12 months to 3 months, making the scheme sustainable. So what's your understanding? They are saying in this manifesto policy that they have already done what they want to do with the NHIS. That's it. They say they rescue, restructure, and increase budgetary allocation. And then they come and tell you in 2 points that what they are seeking to do, they have achieved it. Is that what they are saying? This is what they have done so far. Is it enough?
It's not enough if you still have the majority not covered by the health insurance scheme.
So it's possible to use the NHIS by way of increasing the budgetary allocation to it to take care of what the NDC is promising by way of primary health care. Is that possible?
You see, I think that, like I said, there are a lot of contradictions. What we need to do is this. As a country, we should decide if we are saying that primary health care is going to be free, define it properly, and let the state support it, tell us the sources of funding, and ensure that the needed resources go to these facilities.
So I need this specific education. I need this specific education. By increasing the budgetary allocation to the health insurance scheme, is the MPP able to do what the NDC is promising to do with primary health care?
Now let me also come to this. You see, what is budgetary allocation in the NHI? And I will side with Gordon on one bit, because this is something that we have advocated for. We believe that the resources that are going into the national kitty through the consolidated fund, the NHIA component should be decoupled from that. Create a special account at the Bank of Ghana where all the proceeds, whether collected at the ports or wherever, will go in, and then the authority has access to the money real time, such that they are able to use it for what they are required to do. Of course, that will also come with proper auditing to make sure that things are being done properly. If they have to report to Parliament or wherever, they need to do the same. That way, we can get resources being channeled to the facilities real time. We have situations where there are times you have 12 months, 16 months, 9 months of no inflows going to the facilities, and the facilities are on their knees. How can you then exhibit free care at that level if the resources are not coming in? So we need to draw a line and say that, look, free care is free. We are providing the fund. Government should tell us where the fund will come from. If NHIA will give some seed monies to the facilities, and it's part of the funding mechanism for the free insurance, the free primary health care, and that is also consistent with the laws of the land, there's no problem. The second leg is this. If NHIA is going to operate at the secondary and tertiary levels because primary health care is free, let's decouple it. Then we know that the state itself, whether through taxation, mineral royalties, or whatever it is funding primary health care based on this funding model, and these are the sources of inflows for that. Then NHIA will say, maybe we are concentrating on secondary tertiary care, so that you go in, you take your insurance, and then as and when your condition as a state that you go for secondary and tertiary care, then this insurance bit comes in. But if we try to commingle the two, and we are talking about budgetary allocation, I'm not too sure whether the state itself, beyond the NHIA levies and what have you, also allocates special funds that they give to NHIA. I don't think so.
Okay.
Yes.
So now let me come to Dr. Abakan Nkrumah, and if we can look at this other aspect of the health. Some may have not paid attention to an area that people have spoken about over time, particularly the experts. And I'm talking about the area of mental health. In mental health, the NPP in its manifesto says that it will pass legislative instruments for the implementation of the Mental Health Act. Then what it has done so far, Mental Health Legislative Regulation 2019 have been brought into effect. If they have said anything about mental health, then I have missed, and any one of you can point me to that. On the other hand, the NDC talks about resourcing the mental health fund. It talks about specific, what it will do for Pantang, and it has another specific mention about what should happen to mental health. It actually suggests that mental health, or it proposes that mental health will be a feature of all the teaching hospitals or regional hospitals. There will be provision. Yes, it will be. There will be an integration of mental health in those areas. What will be your comment about that, aside the financial feasibility that all of you have issues with?
Yeah, something. Thank you very much. But before I go to the mental health issue, if you would allow me, maybe I'll just make some comments about the primary healthcare issue that you've been discussing, which is something that I've looked at extensively. I must say that this primary care promise is probably the best thing that NDC said, okay, in terms of form. I think it's important. And Dr. Fenny alludes to.
Okay.
Okay,
Dr. Yankson is saying that he agrees with you, and what you're saying is very true.
Yes, it's the most fantastic thing they talked about, because, you know, if you look at the national health insurance, the premium constitutes only 5% of the total fund.
Okay.
And yet the premium has become a barrier to a lot of people having access to healthcare. So personally, it doesn't make sense to have the premium. So scrapping off the premium and defining a package of services, which NDC calls primary healthcare, so that everybody gets it for free, is actually the way to go. But once again, I want to side with Dr. Fenny that is just simplistic. We need to understand how we fund this. Because if you look at primary care per capita for Africa, the average is $77. And if you multiply $77 by the 31 million, you are around $2.3 billion. The 2017 figure for Ghana was around $49, which is close to Brazil, which is about $50 per capita. That comes to about $1.5 billion, which is in the neighborhood of about 7 billion Ghana cedis for primary care alone. Where is the money going to come from? We need to know where those resources are going to come from for us to be able to implement this. Mind you, our economy is going to grow around 9%, so revenues that will come in is going to diminish. Already, our deficit is ballooning, because if you look at what the Minister of Finance presented in mid-year, a lot of expenditure we are now incurring wasn't there. At least we know that they hadn't budgeted for all these MFI money that they are paying and all those things. And we haven't finished the year yet, so our deficit will grow. So we need to see where that money is coming from. Now come to
mental health.
Mental health. I think that is also a good idea, because this whole idea of having mental health facilities secluded in some place is actually discriminatory, because then people will say that this is the facility for these people. It's got to be integrated into our main health system. But once we say we are going to have all that, what it means is that we're going to expand facilities within our regional centers. We're going to have to deploy a lot more psychiatrists. Where are they right now? Where are they going to come from? Where is the plan to show people how we are training psychiatrists to man these centers? That is a debate we need to engage in.
All right. Now, Dr. Yankson, what would you say about that when you look at the two manifestos? One mentions a legislative instrument that they intend to bring in. It may suggest then that we need to know the content of that legislative instrument, correct?
That is true.
Rather than suggest that the NPP is clueless and has no, any promise or solution for mental health. And I say so to predicate my question because of this comment, which I want to read to you before we hear you on mental health. Now, Kweku says that mental health is often not taken seriously, but it's deadly serious. Young people are suffering from depression and committing suicide without any help. Cost of psychological and psychiatric care and psychiatric care and medication is so high. Add to that stigma and the stupid Act 29 provision that criminalizes attempted suicide. The quality of care at the Accra Psychiatric Hospital, Pantang, and elsewhere in the country is way below international standards. It is a silent epidemic which our politicians don't seem to appreciate. At least the NDC manifesto attempts to deal with it somehow. The NPP's manifesto shows they have no clue about the critical issues on mental health.
Yeah, Samson, I think he's got some valid points in there, but we should also understand that issues like stupid Act 29 provisions are not good for this program. So I'll beg my brother, next time he should deal with those bits. But I think that...
No, you know, Act 29, he's talking about your criminal,
suicide bill,
your criminal offenses, which says if you attempt suicide and you don't succeed,
it's a crime.
You have committed a crime and you go in.
I agree. What I'm saying is that this is the law of the land.
So if I'm tempting it, I should
we
just
can
make sure I consummate it.
For changes. But to describe the act and these provisions as stupid and all that, I think they're a bit of a... But by and large...
People have said words about it.
Well, but for me, not on Newsfile.
Okay, go ahead.
But for me, I think by and large, he has a lot of valid points in there. Let me just say it this way, that I think that the whole country should bow its head in shame. And the two parties, MPP, NDC, they should take the greater chunk of the blame. Reason is that we have all as a country identified the major problem that we have as far as mental health is concerned. We went ahead to pass an act. We have created an authority manned by a chief executive who understands mental health. We have gone the line of wanting to integrate care into the regular health facilities as we all walk into. The problem is that these same political actors have refused consistently to fund the activities of the Mental Health Authority and what the legal provisions.
Yeah, we hear Dr. Akusua say every time.
So
and that place often, they even are running out of food supplies and all of these things.
To be honest with you, the picture out there is not good. I have trained and worked in some of our psychiatric hospitals, and to be honest with you, the conditions there are just not right. The Mental Health Authority has not been properly supported by the state over the period. All the bits that they are all talking about, it is just a scratch of the surface. We should be bold and say that we are committed to changes within the mental health structure per the law's provisions, and then give the necessary funding. But one thing I have noticed, let me quickly add this. You see, the MPP manifesto, I think that the way we are looking at it is also a bit problematic. We need to look at the way they presented it. They started off with what they promised previously, trying to show what they have been able to do, which for me is like, I mean, being truthful and accountable to us. And then more or less indirectly showing that we haven't been able to do this one. Then they go on to a section of the manifesto, what I think it's the part 4, where they describe it as beyond 2020 or something. And then they list specific items. So under health, they are talking about specific provisions that will be the focus beyond what they are yet to accomplish. So it's in two parts. What they have accomplished and have not been accomplished have been stated. So it is going to be a continuum of what they have not been able to accomplish. And then they come up with the part 4 where they talk about health and say we'll focus on health promotion. And
where are you reading? Page what?
Page 156.
Page 156. Okay.
It's the way it was presented. So they talk about issues around focusing on health promotion and prevention as part of the primary health care. So clearly, all of them are interested in primary health care. MPP actually even wants to add health promotion and prevention, which were otherwise not under NHIS, but put them under NHIS for the benefit of primary health care. They talk about, of course, their 111 agenda infrastructure, which I know they had secured some lands and drawings, but of course, until we see the physical activity, for us as citizens, we might never be able to know what goes on.
They've actually gone beyond that. I think just a couple of, or last week or so, there's the question of funds now.
Yeah, that's what I'm saying. That they've had land, they've been able to acquire land, they've done the drawing. So the activities have started. What I'm saying, for us as a general population, there's when we see construction that we really get to know. But clearly, some amount of work is also going on in there. They're talking about construction infrastructure.
All right, thank you. Let's hear Dr. Fenny on the question of the approaches, both of them, the approaches to the question of mental health, where the suggestion, like this message Kweku Boesiako suggested, the MPP is clueless and the NDC rather is providing something that we can look to in mental health. The integration in the hospitals and all the other improvement they intend to do. The MPP should have said more than that, right?
Well, it's not about what the NPP should have said, but it's what about it. It is more about what they can do. You know, so again, we are back
You
to...
should say it first, so we know what you intend to do, and then we hold you to it.
Well, but if you say it and you're not doing it, then that's the problem. So, I mean, I'd rather they don't say it, or I'd rather they don't say it, but say it and then show us how...
We're looking at the manifesto,
yes.
so if you haven't said it in the manifesto, we take it against you that you have no plan for it.
Yeah, you have no clue.
Yeah, you have no plan. No, I think saying no clue, I also don't share with the messenger. Yeah.
So again, I mean, with mental health, I think for a long time we have left funding of mental health to donors, like Dr. Yankson said, and then to the philanthropists, you know, and so we really need to go back and look at how both parties have decided or will decide on funding mental health institutions in this country.
Okay.
We do have the authority. If you go there, they will tell you there are so many problems. The main problem is with funding, you know, and until we can put money in their hands.
So let's put the two together.
Yeah.
One says they are going to pass an LI, which they say has been passed.
Yes.
And then they continue to say that they'll construct 2 more psychiatric hospitals, you know, and rehabilitation centers. That's MPP. Then NDC says we're going to do an integrative process. We will integrate mental health into your major hospitals, and then we will expand, do a phase 2 of a Pantang, and then we will increase the mental health fund. So that's what we have to discuss. We don't have beyond that.
But nobody tells us how they're going to fund this. You know, because if you look at both parties, the NDC is more, puts more on the table for mental health than the NPP. But then nobody tells us how they're going to fund this. So are we going to have a regional psychiatric hospital in all the 16 regions? Is that what they're saying?
From the NDC's
Yes.
suggestion, in your hospital, you will find
The regional.
the regional hospital, you will find the mental health department, so to speak, in there, rather than isolate it somewhere. The NPP is continuing with the status quo to build 2 more psychiatric hospitals and rehabilitation.
Let me help you here. You see, this is what sometimes the politicians do, and it creates confusion in the minds of the ordinary man. The truth is that we have mental health policies and laws that actually talks about the need for integration. We have actually even attempted the integration, just that we have not done it effectively.
Okay.
So what has to be done is that we should follow the prescription as we have now. It runs all the way from the regional to the district hospital.
So the NPP is departing from the prescription?
No, the NPP says the legislative instrument. So basically they are saying that they are going to continue with the provisions of the law.
In building 2 more hospitals, psychiatric hospitals.
So they are even adding on to.
They are departing from what you say exists.
No, they are not departing.
I thought you said the policy is that it will be integrated, which the NDC is promising to do.
No, that is not it. NDC is also saying that they will do Pantine and all that to make it world class. Is that not it?
However, their major policy is ensure that at your regional hospitals you will be attended to.
The mental health policy as we have it now does not scrap the existence of the former mental health structures like the specialized agencies like Pantine and what have you. It doesn't scrap it. We have that. And then the secondary level bit that the new policies or the act has introduced is the integration within the general medical delivery system. So beyond the Pantines and the psychiatric hospital, the anchor folds, you are now also going to see mental health practitioners in the regular hospitals.
What's the best approach? What should be the priority? Integration or new mental health facilities?
Well, I think it's very difficult to select one. Either way, you see, the new facilities...
I thought that we have heard you guys preach that to do away with the questions of stigma and the rest of them, so somebody is not walking into a mental hospital and they are looking at him or something, it should be in the hospital.
Yeah, so that's what we are saying. That's what the policy says, that we should do it in the hospital.
Okay, so is that supposed to be the priority and the best approach, or building new separate mental hospitals?
Arguably, the integration is the best approach. But what I'm saying is that the law does not.
So the NDC has emphasized the correct and the best approach, contrary to the NPP's approach?
No. NDC has stated clearly that they will go to the regional hospital.
And they will integrate. NPP says, I'll build 2 more.
I'll build 2 more, but still continue with the legislation that I have passed. Yeah. So what they are saying is that they are going to implement what is in the legislation that they have passed.
Okay.
So it's virtually about the same thing they are all talking about.
So in that legislation, there is integration.
Yes,
you are sure about
yes,
that?
there is. In fact, we have actually started, except that it is not functioning properly. So what we need now is to focus and ensure that the integration happens.
All right.
What the law has done is that these specialized institutions that already exist, which are the fundamental blocks for the new authority that has been set up, will also be there as centers of excellence. You know,
all right.
Just like we treat all other cases, there are times that you need specialized care.
Thank you. Dr. Abakan Nkrumah, let's have your take on the question. Or you started with the mental health. You did. But I heard you saying something. Do you want to make a short comment so that we can bring this to an end?
Yes, I want to make a short comment. So basically, I think it's about a question that's on the primary care that you were back and forth with Dr. Yankson about the pharmacy issue. I mean, let me say that already, the existing law, that regulates pharmacies, allow them to diagnose diseases of common occurrence and prescribe medicines according to FDA classification. So that is already allowed. And I think that I agree with you on that score, because I have said that in terms of re-looking at the delivery strategy for primary care, there is the need for government to be able to scale down a bit in terms of its commitment in infrastructure and find a way of integrating the private sector into this space so that we can reallocate resources into areas that are needed. I worked with my student Samson recently for us to look at the factors that inform the use of the pharmacy as the first port of call for common diseases, And one of the things we realized is that our sample showed, which was in Gawes, that about 80% of our sample are already going to the pharmacy and using it as their first port of call, even for educated people. So what prevents us from taking advantage of this and also ensuring that we can deploy the GP system? Look, something, if you take a place like Manchester, the population of Manchester is bigger than the population of Accra. But Manchester has only 2 hospitals. The rest are all GP surgeries, and these GP surgeries are owned by private people. The difference is that the financing is by the state, and we can do that. When we do that, we can have some sort of efficiency in terms of production, and financing will be by the state so that everybody have access, and we can save some resources and deploy that in areas that matter most, rather than all of them wanting to build chips over here, build district hospitals in all over the place. My question is, to what extent? So I have a bit of disagreement with Dr. Yankson on that. I think that we can explore that space. In any case, right now we have legislation that is training pharmacists at doctoral level. And oftentimes the question that people say is that if you go to the pharmacists are not there. And I asked the question that if you train people up to this level and you put them there only to administer medications, why would you think that they will continue to stay there? These are resources that we have trained, and we can use them at least to do what the law already provides.
I will take your very final comments on the manifesto positions on health, and then we'll be done for this segment. Then we'll take a break, return with our next set of guests to look at the questions of jobs. But Dr. Yankson, this gentleman says that he says he's a pharmacist and a lawyer, and he thinks that your comments are unfortunate, that the pharmacist's job does not include to diagnose. He says this position is even backed by law. He is Ernest Owusu Abuaji. And then Dr. Omane Boama says that rapid diagnostic tests, RTD, for malaria, diabetes, pregnancy is done in pharmacy shops, among others. We must leverage such capacity and regularize them. Building a health system requires such innovation. There is clear distinction between what NDC is offering as free primary health care. Unlike that of the NPP, ours is not NHIS dependent. It is free for every Ghanaian. Concerns about health financing is legitimate, and I urge Newsfile to take a further step for the parties themselves to discuss it on your show. On mental health, NDC is going for integration, which is consistent with modern trend. Pantan will be a center of excellence. MPP is silent on integration. The limitation of a manifesto does not allow every detail to be captured. Thank you. All right, so your very final comment, and there may be some specific portion of the manifestos on health that you want to comment about, as in criticize or applaud. So let's do that in some 2 minutes each.
Okay, something.
Yes.
Let me just take a minute to correct something. I have never said that a pharmacist cannot diagnose. That is not what I said. What I said is that they diagnose basic things based on availability of things like RDT, like stuff like that, and then also advice. That is why you go to a pharmacist and he will tell you, okay, maybe based on what you've said, you take this, but in 3 days, 2 days, if you are not feeling okay, go to the hospital for the proper or full diagnostics to be done. So let me clarify that. 2, I also added another category. Those in the drugstores and licensed chemical sellers, they are not pharmacists. Their level of training is not the same as the pharmacists. They provide over-the-counter drugs. So let's get the statement properly. I never said that a pharmacist cannot diagnose or a pharmacy shop, but I made distinctions between the properly trained pharmacists, what they do some amount of diagnosis, but there are certain things they advise.
And I drew your attention to the explanation that they are going to empower these facilities.
I don't have a problem with
the
that.
Right, gadgets. That's what they said.
I don't have a problem.
And I thought you had a problem with gadgets.
No. In fact, my major concern even had to do with the licensed chemical sellers and the drugstores.
Okay.
But one other thing that
you have 1 minute more.
Yes, I have seen in the NDC manifesto, which I think we may need a little clarification on. You know, they have this portion 7.12 where they talk about health infrastructure. And the first thing they say is, okay, regarding updates of our health facilities to meet national and global standards, the next NDC government will A, progressively transform all regional hospitals into teaching hospitals. The first question I ask myself is why? You see, we have a system that we are using. We have the primary care, like they are talking about, which for me is a laudable idea. I picked it as my first major item as far as their manifesto was concerned. So
straight to the point quick.
We have the secondary level, which is the regional hospitals, and then the teaching hospitals are now tertiary and to an extent quaternary.
Okay.
They have all promised that they will build regional hospitals for all the regions. So when you say you are transforming all the regional hospitals into teaching hospitals, is it that you are going to eliminate that secondary level care, so that you have only primary and tertiary?
Okay, thank you. So that's a question we should try and find some answers to. Yes, okay. Dr. Fenny, what will be your final comments?
Okay, so my final comments is something we haven't really talked about in looking at both manifestos. Okay. The NPP is very clear on health promotion and prevention, which I think for us coming from the cost side, if we are able to make this a huge focus, it will help us. You know, it will help us in curtailing the huge costs we have from the curative side. You know, so again, this is very laudable from the NPP.
That's health promotion.
Health promotion and prevention.
Okay, and you can't find that in the NDC?
Well, I have
They also talk about some
they do.
preventive health
it's not as
and health
specific
promotion.
yes,
They didn't give it a major write-up like the MPP, but they also mentioned.
Yes, so.
And then there's the second thing that I also wanted to flag about the regulation and institutional framework. The NPP in the Part 4 about what they will do, talk about it. So they talk about harmonizing the areas like HEFRA, the National Health Insurance Authority. They talk about the Pharmacy Council, so they are trying to make this an issue, which is good. If we don't have proper and sound regulation, we'll be back to where we are with the mental health issues we have now. So these are very...
Just to add a quick one to what the MPP manifesto also has this bit about the same regulation bit. The Vice President spoke about it, that they are going to liaise with the Medical and Dental Council about foreign trained doctors. I don't see the hula baloo. We have a law that we have passed, the Health Professions Regulatory Bodies Act. That states clearly that foreign trained professionals will have to go through some form of assessment, exam, or whatever you want to call it, by the Medical and Dental Council, except express provision has been given in the case of, say, specialists. They should allow the MDC to run their program as they are running. They should apply that.
And when you refer to the promotion thing at page 63, page 63, the item S on the NDC is strengthening public health, education, and promotion. And then they talk about promoting healthy sexual and stuff. Yes, okay, so Dr. Abakan Nkrumah, what will be your final comments?
Well, thank you once again. So I think that in terms of the final one, I would also go for the parts on leadership and governance, which I think that for most of the times manifestos haven't looked at that. So the MPP thinking about leadership and governance is very, very important because there are structural challenges in the health sector. And if you don't deal, I said NDC, I think MPP, there are structural challenges in the health sector. And if you don't deal with those structural challenges, it is almost unlikely that you'll be able to implement all the promises that you've made. But finally, I think that one of my challenges with the two manifestos is the fact that they tend to, with the exception of the free primary care and then the digitization, free primary care by NPP, and the digitization aspect by the NPP, most of the items listed there seems to me quite operational and transactional. And they are not bold enough in terms of what we think would lead to some sort of a massive transformation of the health sector. Of course, in the case of the NPP, I understand them because they are already in power. They had a very transformational manifesto in the health sector in 2016, which they are continuing. But the way they have articulated it is problematic because you need to pick the two together and to be able to make some reason out of it. And so that would be my final comment.
And on that one too, Dr. Yankson agrees with you on the final bit. So I'll say, ladies and gentlemen, thank you so very much. Dr. Justice Yankson, General Secretary, Ghana Medical Association. He stays with us for the next subject. Dr. Amapoka Fenny is Research Fellow, ISE. And then Dr. Gordon Abakan Nkrumah is Senior Lecturer, University of Ghana Business School. When we return, we will have Dr. Priscilla Chumesi Bafo, who is Economist and Senior Lecturer, Department of Economics at the University of Ghana, and Dr. Edward Asiedu, who is Economist and Lecturer, Department of Finance, University of Ghana Business School. We'll be right back, and we'll share some of your views with you.